Assalamu alaikum wa rahmatullah. So for this session, we will start with to remind you or to refresh you with the basic life support, especially for adults. So anyway, there are many causes, there are many things that might lead to cardiac arrest. Who can just mention some of them? What might be the cause of cardiac arrest? Did you remember anything related to cardiac arrest? Why the person might have cardiac arrest? It might follow shock. In shock, what will happen? So in shock, what is the thing that happened, and the consequence of it might lead to cardiac arrest?
Ischemia.
It will lead to loss of blood supply to because the blood pressure will be going down, so the blood supply to the brain, it will be less, and the consequence, it might lead also to the process of cardiac arrest. She said other thing, it is accident. I heard accident. Yes, in case of accident, many accident, it might lead to brain injury, and it might lead to cardiac tooth. Later it will lead to cardiac arrest. It might be due to affection of the cranial nerve that supply the base of the tongue. Because of that, the base of the tongue, it will relax and it will close the airway. In patient with cardiac problem, like in patient who are having those coronary artery disease, it is expected that he might have also cardiac arrest. The pulmonary embolism, in case of some cases of DVT, sometimes there will be sloughing of some of the clot, and it might go to the heart, it might lead to pulmonary embolism, it might. So those conditions, it might lead to stoppage of the heart. Electric shock, one of the causes also. So there are many causes, regardless to the cause. When it is happening, so what we have to do? What we have to do? We have to do so. So, but when we are coming, usually we don't know if the patient is conscious or not. So sometimes we might be there when the patient collapses or when the person collapses and he loses his consciousness, and it might be a case of cardiac arrest. So whatever, if we are coming and we find somebody is lying and he is not moving, or if somebody collapses in front of us, what we have to do? The first thing that we have to do is to recognize that it is an emergency case in this case. So we have to interfere. How we can interfere? If we are outside, in this case, we have to call for help. But after we check the client if he is having cardiac arrest or what's the problem that the person is having. So the first thing that we will come to the client, try to call him by his name if we know his name. If we don't know his name, in this case, we'll try to call him by the usual word that we are calling people in his age. أخوي, الوالد, الوالدة. So according to, then when this is before reaching. When we reach there, then we have to tap on his shoulder. Are you okay? If not, if he responds, it means that he can breathe. He is conscious, still having some consciousness. He might be having shock. or fainting. In this case, we have to deal with that. We can raise his legs in order to increase the blood supply to the brain. If he did not respond, in this case, what we have to do? What's the consequence? What we have to do? So we have to check the airway. How we check the airway? So the first thing, if any tight clothes, we have to untighten it. So we have to feel, look, and listen. Look, listen, and feel. So I am looking to the chest to see the chest movement, if chest movement is there. Feeling if there is any air is coming, and listening to the breathing sound. If no breathing, if I didn't feel anything, if I didn't see any movement, I have to check also the carotid artery for pulse. No pulse is there. In this case, it is definitely cardiac arrest. So what I have to do, I have to call or ask someone to call 9999. I have to start the CPR. If I am in the hospital, in this case, I have to activate also the emergency or cardiac unit in order to, because there is a group for cardiac, dealing with cardiac arrest, they will come and for doing resuscitation. So, yeah. This is again the problem. In case if you are outside and didn't have a book, there is some issues here. Shall we do mouth-to-mouth breathing? Huh? No? Why? Yeah, yes, you can. If barriers is there, we can use some barriers. So even sometimes, even the mask, it can be a barrier. It will help. The issue that we are dealing with, are we going to leave that man to die while we can do something? Or do we have to do, so there is, we have to wait. What is the consequence? What is the result of that? So, I am not saying that viral infection cannot be transmitted if we are doing mouth-to-mouth breathing. Yes, it can be transmitted. Possibility is there, either from me or from him. But in the other hand, I have to wait there. In this case, which is better? To lose the life of that person? Or even if, I don't know if he is having the virus or not. So still, I didn't want to discuss it too much, this issue. But you are the one who will judge the condition. Because in this case, whatever the condition, it will be treated after that. Anyway, so then the first thing that I have to do is to open the airway. I told someone to call for 12:09. I examined the breathing. No breathing is there. I examined the carotid pulse. No carotid pulse is there. This is the site of the carotid pulse. The side of trachea. Just gentle pressure. Don't press too much, because if you are pressing too much, you are closing the artery. And in most of those cases, when fainting is there, the pulse will be weak. So after that, I put my hand on the patient's forehead. I tilt the head, lift the chin. Then I will see also breathing is there or not. Then I have to start with the compression. Compression, I put the palm of the hand here on this middle of the sternum. For an adult, I will use the two hands. The compression, it should be by my body, not by my hand. So my hand should be straight. Compression, it will be 30 compression, then to breathe. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then I put the ambo bag inside and give to breathe. So 30, then to breathe. I will continue. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then another 2, 3. When I am giving breathing, I have to look at the chest to see if chest movement is there or not. I will continue for 5 cycles. After 5 cycles, I have to check the pulse and to see the breathing within less than 10 seconds. It should not exceed 10 seconds. Then I have to continue. I have to do continuously. When I have to stop? In which condition I can stop? If the patient can breathe and sign of life is coming out. So sign of life is coming out. Either he coughed, either I saw his breathing. So in this case, it is a sign of life. Or this is one condition. What other condition? If another trained person is coming and he took over. Either the trained person from the institution or beside me, or if the emergency people are coming, it is similar. So if anybody is coming and he is taking over. The third thing. Just raise your voice, I cannot hear you. No. No. If it is more than 5 minutes or even 1 hour, I have to continue because I am not in a position to say that this patient died. I have to continue. So, and this, if I am exhausted and I cannot do anymore, there is no one to help me, I am alone, still they did not come from the emergency people or any other person to take over, just listen. And I become exhausted, I cannot do anything. So I cannot say that he died because this will happen in the hospital. They will see the ECG and the monitor if it is still flat. In this case, after that, they might say that the physician will give. Or he will tell her the diagnosis as that man is so those conditions I will not stop. Or if the AED machine is available. Did you remember the AED machine? So the AED machine, here this is the type of AED machine that we are using. At the hospital, did you saw the monitor that's there in the crash trolley?
Yes.
The defibrillator which is there on the defibrillator which is there, it can be used as AED machine and it can be used as a professional defibrillator. What is the difference between that? The difference between that if we are using it as an AED machine, in this case it will give a prompt for us. It will give instruction for us what to do. And the dose, it will be specified by the machine itself. If we are using it as a professionals, in this case we have to adjust the how many joules that we are going to give for that person. So we have to adjust the level of the joules. So did you understand what's the difference? And it will not give us a prompt. It will not talk to us. But this type of AED machine, now they are trying to have it in most of institutions. So just
plug in pads connector.
When I put it on, immediately it will say plug in the pad connector.
Plug in pads
Those
connector.
are the pads. So
Plug in pads connector.
after plugging it,
Remove clothes from patient's chest.
so it will give us from what to do.
Peel white pads from grey plastic case. Attach
The
pads
pads.
to bare skin exactly as shown. Remove clothes from patient's chest. Peel white pads from grey plastic case. Attach pads to bare skin
It will be
exactly as
attached
shown.
like this. After that, it will analyze.
Look carefully
Now
at
it
the
will not
pictures
analyze.
of the white adhesive
Why?
pads.
Because there
Peel
is
one
no
white
signal
pad
from
the grey case.
this non-live.
Place pad exactly as shown.
If we are applying it to a,
Press firmly to bare skin.
he will not stop. So he will repeat those things because there is no signal from the dog. So you will find that it is there, the site of putting the bag, where to put the bag, it is there. And also in the defibrillator in the hospital, you will find also that on the Bible that you have in the electrodes, also it is shown where to put each electrode. If response is there, if he is an individual, actual individual, what will it will give me after that? It will say that now analysis. So when I put it, it will start analyzing the heart rate or the electrical impulses from the heart. If no impulse is coming, or if heart arrhythmia is there, the machine, it will tell me that shock is required. Just analyzing for the shock. Then this button, this one, it will start to blink. It will tell you, be away from the client and press on the blinking button. While Those pads are there. Did you understand what we have to do? No. Then the shock will be delivered. If shock is delivered, no one should be touching the client, because if I am touching, I will get the shock. It is an electric shock. So I got the shock and I might. In dealing, by the way, in dealing with patients, and it happened, some of the patients, they might have a built-in machine. They are having recurrently cardiac arrest, and that machine, it will give a shock automatically with them. And it's happened with one of the staff. She got the shock while she was dealing with that person. She didn't recognize that he is having the machine, and she didn't recognize even that he got cardiac arrest during that. So you have to know your patient, because those patients, usually they are coming frequently to the hospital. But only one case I heard about it here. And usually it is not fixed here, it's fixed outside. So anyway, the other thing that some of the clients, they might have pacemaker. So if the patient is having pacemaker, the pad should be applied away from that pacemaker. If they have a built-in pacemaker. So if they are having that regulator, in this case, we should use the pad away from that regulator. Those are the conditions that we have. So if after, when the patient a signs of life are observed on him, what we have to do? If we are waiting for the emergency people for the ambulance, what we have to do? We have to continue observing him, and we have to put him in the recovery position. But for this man, it's difficult to put him in the recovery position. Recovery position, we have to put the hand that's to the side that we want to put the patient to it. We will put it under his head. The other hand, we will put it over his chest. Then we will tilt the patient toward us. By that, he will be in the recovery position. The purpose of that, because in those conditions, it is expected that the patient might vomit. Or any excretion can come out from his mouth. If any excretion is coming, there is a danger that it might go back to the lung, and it might lead to aspiration. So in order to avoid that, and in order to avoid any compression over the diaphragm, so we will put the patient to the side lying position or to the recovery position. So, sometimes they are saying it is the waiting position. وضع الانتظار بالعربي يسموه. So this will help for better breathing and also for better drainage of any secretion and prevent the backflow of the secretion to the respiratory system and prevent aspiration. So we will keep him and keep observing him until the ambulance is coming and they took off. So this is mainly what we are doing in case of the cardiac arrest. So the first thing that we have to recognize that the case to start to act by, as I told you, to try to call the client before coming to him, just from away. Then when we came to him, if he did not respond, we will tap on his shoulder, are you okay? If he did not respond, then I will put his head, tilt his head and lift his chin in order to open the airway. Then look, listen and feel. If no breathing is there, I didn't saw any movement, just movement. I didn't feel the air when it's coming from his mouth. I didn't hear any breathing sound. I will check the carotid artery for pulse. No pulse is there. I will start with the heart compression, 30 compression, then 2 breathe. 30 compression, 2 breathe. For 5 times. After each 5 circles, I have to check again for breathing and for pulse with a less than 10 seconds. The rate, it's preferable, it's advisable to have a rate of 100 compression per minute. The thing also that we have to concentrate on, use your body weight rather than using your hands. Especially for those with a small body build. They will not be able. And also it is tiring. It is difficult if I am using my hands. I will tire easily. But if I am using my body, it is easier for me. The compression, depth of the compression, it should be not less than 7 centimeters, around 3 inches when I am compression. It is not just only a slight compression like this. So it has to be, the compression, it has to be deep in order to reach the heart and it leads to contraction of the heart. It is not only counting for 30, and it has to be an actual compression over the heart. So then the breathing, mouth-to-mouth breathing is advisable. If there is a barrier, it is better to use the barrier. Even the mask, it can be used as a barrier. Yes, regardless to what they are, the condition, we want to save the life of the person. So if the ambu bag is available, we will use the ambu bag for breathing. But be sure that the head is tilt and the chin is lifted in order to see. The chest movement is there. But if I lift the head like this, without tilting the head, any movement, nothing is happening. And I am feeling that that is coming from here. So it is useless. So usually I have to open the airway to be sure that the airway is open and in order to work properly. طبعا you are hearing many times here nowadays the term which is swallowing the tongue. بلع اللسان. Actually, there is nothing scientifically. There is nothing called swallowing the tongue. يعني when we say swallowing the tongue, you will expect that the tongue is going back and the tip of the tongue is going back and you are swallowing. But it is not like this. It is the relaxation of the base of the tongue. due to mostly due to head injury. Regarding to any cause, due to embolism, due to head trauma, it has happened many times in the playing area, in a playing field, while the player is either hit by the football or he fall down and he lose his consciousness due to that the base of the tongue is becoming relaxed and close the airway. Why? Because there are 3 cranial nerves supplying the base of the tongue. When head injury is there, those 3 cranial nerves might be affected, and they will, in this case, the tongue will relax and it will lose its ability to be in position. It is normal position, and it will close the airway. So when we are tilting the head and lifting the chin, the patient may return back to breathing normal, even without doing the compression. So it is a simple thing. Just tilt the head and lift the chin. Then, because of that, we have to do it first before even checking the respiration. If the patient is not responding, verbally or just lift the chin and tilt the head. By that, you are opening the airway. Check if breathing is there. Then check if there are if pulse is there. Is it clear? Any question? So you can start to. There are 3 ones that we can use it. Yes.